Hello class, my name is Lynetta Walker and today I'm going to be going over the disparities in healthcare for Black women. Inequality comes in many forms for people of color, but race-related health disparities are among the harshest and most resistant to progress. My focus will be the sociological approach to health and medicine. I am a nurse, and as an African American woman, I want to talk about the racial disparities that affect Black women's health. Spreading awareness and providing education on this topic is very important to me. This is an issue that many people are unaware of. Black women have a right to be aware of and educated on this topic to help spread awareness and possibly help others to avoid this tragedy from happening. More than 700 women die each year in the United States from causes related to pregnancy or childbirth. Black women have a maternal mortality rate 3 times higher than that of white women. At least 60% of maternal deaths are preventable. Dr. Wanda Barfield, Director of the Division of Reproductive Health and Assistant Surgeon General in the U.S. Public Health Service, says the racial disparity in maternal death rates is a dramatic argument for prevention efforts that addresses diverse populations. The CDC's Principal Deputy Director, Dr. Ann Chushat, notes that every death reflects a web of lost opportunities, including lack of access to health care, missed or delayed diagnosis, and failures by doctors or nurses to recognize warning signs. The CDC says healthcare providers need to help patients better manage chronic conditions that could be exacerbated by pregnancy. According to a CDC report, more than a third of pregnancy-related deaths were due to cardiovascular conditions. The conflict theory and functional theories can be applied to this topic. The conflict approach emphasizes inequality in the quality in health and in the quality of health care. The functionalist approach emphasizes the good health and the effective health care are essential for a society's ability to function, and it views the physician-patient relationship as hierarchical. There is evidence that social factors, including education, employment status, income level, gender, and ethnicity, have a marked influence on how healthy a person is and the quality of health care they receive. Maternal mortality is a key indicator of health inequality. Power and authority can also be applied to this topic. Power hierarchies fill the healthcare industry, and the traditional relationship between patient and provider has been viewed as paternalistic, with patients often taking subordinate roles. One example of the use of power and authority and the disparities in healthcare for Black women is the experiments and procedures on enslaved women by James Marion Sims, the father of modern gynecology. Enslaved women were not given a choice to consent to these cruel operations and experiments, which were conducted without anesthesia. Doctors in the 19th century believed that Black people experienced less pain than white people, a stereotype that is still widely believed and taught today in modern-day medical education. Media is beginning to shed light on this topic. Tennis icon Serena Williams did an interview with Vogue and discussed her own experience with the life-threatening scare after giving birth. Williams was at risk for a pulmonary embolism and was experiencing shortness of breath after an emergency C-section. She recognized the symptoms and asked for a CT scan and blood thinners, but the medical staff didn't take her seriously. Blood started pooling inside of her, which eventually led to another emergency surgery that was necessary. The delay in care could have cost her her life. Mass media helps to generate awareness about this issue. In conclusion, Black women in the United States experience unacceptably poor maternal health outcomes, including disproportionately high rates of death related to pregnancy or childbirth. Both societal and health system factors contribute to high rates of poor health outcomes and maternal mortality of Black women. There are amazing institutions that are working tirelessly to address the multitude of health disparities for Black women. Congress and citizens should exert pressure on government funding to dedicate more research for conditions that impact Black women. I want to thank all of you for taking the time to view my video. I hope that you have learned more about the inequalities in healthcare and the disparities Black women face. I hope you all have a wonderful day. Thank you.